Dr. John Wilson Etolu is my name. I'm a consultant physician at Etolu Regional Referral Hospital. I'm also in charge of COVID-19 care and treatment in the Teso region. I am a team leader. I head the treatment unit here at the referral hospital. To date, 29th of September 2021, I'm happy to give people an update on what is happening at the Teso region. I want to remind us that about a month or so ago, the incident commander for COVID-19, Lieutenant Colonel Dr. Chove, declared Toroti as an epicenter, Teso region as an epicenter for COVID-19 in Uganda. And since then, Teso region still remains an epicenter for COVID-19. If you look at the 10 top districts in Uganda who are having the highest number of cases of COVID-19, 5 of those actually come from the Teso region. They include Kumi, Ngora, Serere, Soroti, Kaberemaido. That's the district with the highest number of cases in the country. So that still confirms the fact that the Teso region remains an epicenter for COVID-19. Currently, on the ward, we have 49 patients admitted with severe COVID-19. Of the 49 patients, 39 of them are on oxygen. So it means only 10 are not on oxygen. About a month or so ago, our average admission has been about 10. The admission rates per day has at least come down. We admit on average about 5 patients every day. And all the patients that we're managing right now, from the time we were declared an epicenter about a month plus ago, are all patients from the Teso region. I want to let us know that Teso, Soroti specifically, we've been getting patients all over the country. But over the last 1 month or so, all the patients that we're admitting are actually all from the Teso, districts of Teso. And the district where we get the highest number of patients still remains Kumi, sorry. The highest district with the cases is Kumi, followed by Ngora, and then Oda. Of these patients that we are admitting here at the unit, majority of them are really elderly patients. About over 80% of all our admissions are elderly men and women more than the age of 65 years. So if you look at how burdened we are as a region, COVID seems to now be a disease of the elderly, given our admission rates in the hospital. There are also a number of patients who are on home-based care getting treatment, and as a Soroti, we currently have about 113 patients on home-based care. Oxygen still remains the most important drug that our patients require, and on average, our consumption of oxygen is about 60 cylinders in a day. 60 oxygen cylinders in a day. We want to thank Ministry of Health that has supported us. As a hospital now, we have over 300 oxygen cylinders. And over the last 1 month, we've had trucks again sent by Ministry of Health and national medical stores that deliver oxygen for us on every other day basis. Just this morning, we received a truck from Kampala with 80 cylinders of oxygen. So the supply has been fairly consistent from Kampala, particularly by NMS, and our oxygen needs are met, given the fact that as a hospital we have 2 dedicated trucks by Ministry of Health that support the hospital in delivering oxygen on every other day basis. It is sad to note that majority of our patients that we're admitting at the COVID unit are not vaccinated for COVID. In fact, right now, all the patients who are admitted are not vaccinated for COVID-19. And that still is a very huge challenge for us, because our vaccination coverage still remains quite poor. So in terms of what remains a big challenge is that our patients that come to the COVID treatment center come in very late, and majority of them that we have lost have actually come in very sick, to the point where it becomes very difficult to save them. So coming in late is one of the biggest challenges that we are facing at the treatment center for COVID-19. In terms of supplies, yes, ministry is really being very supportively. Biggest challenge is that our patients are really coming in quite late, and these are old men and women not vaccinated for COVID-19. They require support from their younger people, so that remains really a huge challenge for us. In terms of this patient that we managed over the last 1 or 2 months, some of them have been pregnant mothers, and as a treatment center we have looked after 45 patients who are pregnant and having COVID-19. Majority of them have delivered normally. A few of them have had delivered through cesarean section. The youngest mother has actually been 16 years of age, and our mothers have actually done very well. At the peak of the second wave, we lost a number of mothers in Mulago, the treatment centers, but as a region, we haven't lost pregnant mothers to COVID-19. In terms of vaccination in the region and specifically in the hospital, we began vaccinating patients for COVID-19 earlier this year, and the vaccination has been going on well. Initially, we began with AstraZeneca vaccine. Along the way, we got Sinovac. And as a hospital, we vaccinated over 3,000 people with COVID-19. There was a worry about AstraZeneca expiring, but I want to let us know that no vaccine has expired, at least in the Teso region. And I want to let us know that today, people went back home without getting the vaccine because our vaccines are done. We have run out of the vaccines. We have submitted a report to the Ministry of Health, and we're hoping that by Friday we should be getting another batch of the vaccine. Initially, the uptake had gone down, but over the last 1 week or so, the vaccine uptake has gone up again, and no wonder the vaccines have actually run out. No wonder the vaccines have not expired on us, especially at least for us in the Teso region. So we hope that by end of this week we should be able to get the vaccines. I just want to re-emphasize, who should be vaccinated? For now, as a policy, every Ugandan more than the age of 18 should be vaccinated for COVID. However, we prioritize the high-risk groups, and this includes individuals who will be above the age of 50, health workers, teachers, security people, and also individuals with comorbidities like pressure, hypertension, diabetes, asthma, HIV, among the high-risk groups. So what that means is that if I have a 60-year-old and a 20-year-old, I will give the vaccine to a 50-year-old ahead of the 20-year-old, because the 50-year-old is at high risk, is a high-risk population person. As a country, our target is to vaccinate about 22 million people. Our coverage is still not as good. We have over 2 million vaccinated. Our coverage is about below 10%. And with the vaccines now available, we hope that by December this year, we should have vaccinated a significant amount of people, especially the ones that are vulnerable population. Like I said, our unit here has elderly patients more than the age of 60 not vaccinated for COVID-19. So we really want to prioritize as a region to make sure people more than the age of 50 should really be vaccinated. So as soon as we get the vaccine, we are going to move to the communities, the villages, to vaccinate people, especially those above the age of 50. I also want to re-emphasize, people still fear, there are those number of people who still fear the vaccine. Actually, there's fear that Those who are dying of COVID are the ones who are vaccinated. If you have complications, it will take you worse. I want to let us know that the vaccine is safe. And I want to encourage all of us, as long as you are in Uganda more than the age of 18, please make sure that you get yourself the vaccine. There are also reports of many types of the vaccines available now in the country. We have Johnson & Johnson, we have Pfizer, we have AstraZeneca, and we have Sinovac. And people keep calling and saying, which one should I take? All these vaccines that I've just talked about are effective, they are safe, and so whichever vaccine is available at the vaccination site near you, please take it up. If you go to your nearest vaccination site and the Sinovac, get Sinovac. If it is Johnson & Johnson, please get, because all these vaccines are safe, they have been tested by the World Health Organization, they're effective, and so whichever, the best vaccine is the one that you're going to get, is the one that will be available near you. So I want to encourage all of us that make sure you get vaccinated. In ending my talk, I want to just re-echo that COVID-19 has no cure. The only remedy that we have for COVID is the vaccine that prevents it from getting COVID. And Murago and Nambole did a survey recently, and they published their findings recently. And they found that patients who were vaccinated were not likely to die compared to those who have not vaccinated. So that shows that once you are vaccinated, you are not likely to die. But if you're not vaccinated and you get COVID, you are more likely to die. So the vaccines have been proven to prevent people from dying. Also, we have known that vaccines prevent people from getting severe forms of disease. So if you got a vaccine, you got COVID, you will get one where you need to be at home. Or if you're admitted, you need to be admitted, but you don't need oxygen. But if you're not vaccinated and you get COVID, you're likely to be on oxygen, and you're also more likely to die. So I want to encourage people to get vaccinated. We have also analyzed our data here about a month ago, and it again shows that people who are vaccinated were not likely to be admitted. Actually, we have admitted a few patients who had gotten the vaccine, and except one, all of them did not require oxygen, except one who had got vaccinated but required oxygen and he still survived. This is an old man from Kapchorwa. So this shows us that the vaccines protect us from dying, protect us from getting severe COVID. And again, I want to encourage all of us, please let us get vaccinated so that the more we are not vaccinated, the likelihood that we shall get a third wave as a country. But if we get vaccinated as quickly as we can, then we will avert the third wave. We all know the dangers of lockdown. For us to avoid all those things, let's just make sure that we all get vaccinated for COVID-19.
He's coming one person.
Okay.